Throughout this pandemic, healthcare workers have been putting their own lives on the line. One of them is Dr. Michael Gardam. He's been through many health emergencies, but nothing as extensive and dangerous as COVID-19. It's a lot of pressure to be responsible for the health of the public. And then Dr. Gardam had his own scare. As Jeff Semple reports, he had to make a major decision.
As COVID-19 cases climb again, staff on the front lines are worrying less about infection than exhaustion.
Each day brings a new potential COVID outbreak.
Dr. Michael Gardam is no stranger to the pressures of a public health emergency. Gardam was on the front lines of the SARS outbreak in 2003, H1N1 in 2009, and Canada's response to Ebola in 2014.
If there's lots of virus in the room, got caught with their pants down. Certainly if you have a lot of cases of flu out there.
He's given countless media interviews, providing a calm hand in the storm.
There was so much fear. And when you're the person who's advising on what to do and you're in all those meetings and you're speaking to people in the media and you're getting hit with these waves of fear, that is exhausting.
So this is our COVID-19 tile.
In the first wave of COVID-19, Gardam was chief of staff at this Toronto hospital. During a shift back in May, he suddenly felt a pain in his chest.
As a physician, you spend your first 10 minutes running through a list of things that this could be in your head and then thinking, this can't possibly be cardiac.
But as he stumbled into the emergency ward, he realized that's exactly what it was. Gardam was having a heart attack caused by a blockage in his left anterior descending artery, morbidly nicknamed the widowmaker.
Talk about access to healthcare, right? You know, I had a heart attack in the hospital. They treated me extremely quickly. If it would have happened the day before, I wouldn't be here.
Now, 7 months later, Gardam, a former marathoner, has made a full recovery and a life change. In October, he moved out of the big city to the ocean on Prince Edward Island.
The level of chronic stress and anxiety, which I think was compounded with the pandemic, that was like a major wake-up call for me.
He's still working full-time, often remotely, and at 56 says he has no interest in retiring. And this is no time to back away from a fight.
I know that there's been some pushback about using war analogies. You know, the way I look at it is that it's kind of like we're in 1944 right now. You sort of think that you can see an end to this, but it's not going to happen tomorrow. And we've got months of slog to get there. And you can't stop. If you stop, you're going to lose all of the things that you fought so hard to win.
Jeff Semple, Global News, Toronto.